There's a recent study out in the literature that says that if you do all the right things from a nutrition and fitness perspective, you can add 15 quality years of life to your life on average across the population. I mean, that's just crazy, right?
Do you need a Fitbit for your blood? One of the key engineers behind Apple Watch and Apple Health has a new fitness product. It's an infrared spectrometer that measures your blood health and how the food you eat and the exercise that you engage in impacts it. In other words, if you're wondering if that sugar high is real or if your keto diet is actually good for you, this new product might be able to tell you. It's called Core, and here to chat is the CEO and founder, Bob Messerschmidt. Welcome, Bob.
Thank you, John. Pleasure to be here.
Hey, it is great to be here. Let's kick it off. What have you built?
We have, as you very accurately said, is an infrared spectrometer that we can put into people's homes. And this has never been done before. We started out with that question: what could we learn if we could have big data coming from thousands, tens of thousands of infrared spectrometers in people's homes? Could we even build them at a consumer price point that would make it a consumer value proposition? And then what could we know? The big breakthrough came a little while after we had the hardware well developed and we were getting lots of nice data from it. The big breakthrough came when we realized that we had a new kind of data here. And with that, we could show people what their response was to very well validated nutrition and fitness strategies. And so what we realized at that point was that this is data that's not available to anyone, anywhere, at any cost based on blood spectroscopy. We noticed in the research literature that there's a huge range of response in any clinical trial that's done for anything that ultimately is shown to be an effective nutrition or fitness intervention. There's always a range of response. So some people in the clinical studies get lots of benefit, and some people in the clinical studies get no benefit. And so that gets recommended out to people by big wellness, right? That it's clinical studies have shown something to be beneficial, but is it beneficial to you? And we realized that this personalization piece, we had a technology platform that could show people that, and that you can dream from there about what people can know and how important that's going to be ultimately. We think it's absolutely huge.
So, contextualize this for us a little bit. When you get Core, what do you get? Do you get something that plugs into your phone? Do you get a box? What is it? What do you get, and how do you use it?
Yeah, it's a hardware device. It's an actual spectrometer, a very research grade, in fact, infrared spectrometer that we had to do a lot of clever engineering to get it to a consumer cost and price point. You set that up in your home. It's a Wi-Fi connected device, so it sends data up to the cloud in a very secure manner. There's end-to-end encryption, and all your data is anonymized and private. And we use that data to build big models of what's happening when people do very specific nutrition and fitness interventions. We do that first in a research study. We have hundreds of spectrometers in the homes of research participants, and these are IRB approved research studies. And we find a pattern, a molecular fingerprint of what actually is occurring when people do a specific nutrition or fitness thing. Let's say it's eating salmon or eating pistachios or choosing to walk 10,000 steps in a day. Those all cause very specific pattern changes in the blood spectroscopy. And then we can tell you personally how much, if you then replicate that study that we've done in the research, we can tell you whether you're at a high end responder or a low end responder. And that's really what's new.
It sounds like you have some very happy birds in your office.
Sorry about that. Yeah, I imagine they're not muted.
They
They
are
are happy
not.
because it's springtime here in Menlo Park. Well, it's springtime everywhere.
Exactly. Hopefully, they can be happy quietly as we continue, but it's all
Yeah,
good.
apologies.
No worries, no worries. So, I get Core. I bring it into my house. What do I do? I know that, for instance, an Apple Watch and some other products like an Aura Smart Ring, those sorts of things can see through your skin, see
Yeah.
into your blood, and make some assessments of things based on that. I mean, at the very basic level, what's your heart rate, those sorts of things. But there's the oxygenation, those sorts
Yeah.
of things. Is
Yeah.
your device like that, or do you actually take a sample?
We actually take a sample. We There's about a 3 order of magnitude sensitivity disadvantage of trying to do blood chemistry measurements transdermally across the skin. I've
That's
spent
significant. Three
years
orders of magnitude.
That's and I've spent a lot of my career developing technologies like that, and there's some very successful ones, of course, like pulse oximetry is the classic, right? You can measure blood oxygenation across, actually transmitting right through a finger, and but they're kind of few and far between the applications that you can do successfully transdermally, just because of that sensitivity limit. So we said the next best thing, how can we really reduce the friction of getting a very tiny blood sample? And really what it comes down to is volume. It's
Mhm,
if you can get it down to a microliter, or in that range, there are a number of ways to get a blood sample now that are effectively painless. People with diabetes do it every day, multiple times a day, for blood glucose measurements. But we get a lot of user feedback because we are launched now, and we get feedback from users. And that's not the biggest pain point for them, is getting the blood sample. The bigger pain point is sticking with the programs, just staying engaged, and we're
mhm,
those are problems that we're good at solving here in Silicon
mhm.
Valley. So we try to make it an engaging experience for people.
This episode is sponsored by Dollar Smart, my creator coin. Yeah, it's crypto. No, it's not a scam. Buy some to support the show, sponsor the show, get weekly rewards as the coin grows, or just to be part of the community at rally.io/creator/SMRT. So I take a tiny little sample. I prick my finger, and we get some blood out of that. You do some analysis. Do I see almost instant results? So Sunday is my cheat day.
Yeah,
Every other
yeah,
day, I'm pretty careful about what I eat, and Sunday is
yeah,
my cheat day. I can eat anything, and I
yeah,
often do, um, including something that I'm thinking maybe I shouldn't. Way too much sugar. Would I
yeah,
see that
yeah.
almost immediately?
Not So there are really two cadences that are important with blood chemistry data, and we're following the data, right? So we want to know, how long does it really take to evoke the changes that are of significance in blood chemistry? If you go to your doctor, the doctor is looking at biomarkers only really once a year. We find these nutrition and fitness loops take some time to be evoked. They take several weeks. So we run these core programs for 21 days. And during that 21-day period, we take 4 finger sticks, one at the beginning, one at the end, and 2 in the intermediate weeks. And so that's a cadence that is acceptable to a lot of people. It's not too many finger sticks. And that gives us our data set that we need. You're also, at the same time, you're accessing the app every day to check off and make sure that you're continuing to do the program steps. So there
Mm,
is basically a list of 7 things in a to-do list that you check off, that you've decided to do when you enrolled in the program. So did I eat salmon today? Did I walk 10,000 steps today? Did I get 7 hours sleep today? That sort of thing. And these are all things that we've started with because there's medical evidence behind them.
mhm, mhm. Do I
So then the
have to
first
keep track
data,
of what
I should just finish that. You get the first data from core at the end of that 21-day period.
Okay, interesting. Okay, okay. Uh, that'll be interesting to see if you keep that. I mean, you're gonna learn as you go, and you're gonna see what works and what doesn't work. It'll be interesting to see if you keep giving data after 21 days, or change to give data immediately after the blood sample's taken and analyzed,
Yeah.
or next day or something like that.
Well,
Um,
like I say, we have to follow what we see in in the blood chemistry change. It just doesn't happen instantly. There's really nothing to see after
Yep.
a day. There's the one thing that you can see intraday. Well, there's several things you can see intraday, but the one thing sort of metabolically interesting is glucose.
Yes.
Uh,
Yeah.
and there are CGMs for that. We're not
Mhm.
focused on that at the moment. We're focused on these pattern changes, which are due to things like, well, it's anything in blood that is a can have an impact on long term uh, health and longevity. So it takes a while to
Interesting.
develop.
Yeah. Do I have to keep track of what I eat then and how I exercise? And do you get that data from other apps via Apple Health or Google Fit or something like that?
We are linked with HealthKit, but we're not
Yeah.
pulling in data from it at the moment. That doesn't mean we can't in the future. I was at Apple. I learned, I learned a few things at Apple, and we started out with the strong belief that nobody's going to input a lot of data. I mean, in general,
Mhm.
there's a community of people who are very willing to input a lot of data into their apps, but for the most part, people aren't going to do it. And so all we ask for is you first sign up for a program, and what a program is really just 7 practices that you want to try out to see whether you yourself are responsive to them or not. And then
Mhm.
all you have to do is click a checkbox every day to let us know that you've done it, um,
Mhm.
and that's it. There's no real typing or data entry.
I have tried to do the quantified self thing with food and failed. And I've tried multiple times, and it's a pain in the ass. It
Yeah,
just
it
is.
is.
It
That's it.
just really, really is. Now, if somebody ever comes out with the app where you can literally snap a picture of whatever you're eating, and it'll automatically know how much it is,
Yeah,
what it is,
right.
and the caloric density, and all that's the composition, all that
Yeah.
stuff, they're going to be a billionaire because that's the easy way to do it. So let's talk about what core tells you. What does core tell you that you wouldn't otherwise know?
Right. So it tells you on a personal level your responsiveness to any of the myriad nutrition and fitness guidances that are out there. I mean, big wellness has a lot of claims. A lot of it is unvalidated, and we stay away from that. But a lot of it has medical evidence behind it, and so we've focused on that part of it. We have our medical director and his team look at any possible nutrition or fitness intervention and says, okay, can I and my MD buddies look at this and say, yeah, this is something that there's strong evidence that it's going to impact healthiness over the long haul. And we can and like I say, the evidence is that there's a big range of benefit that any given person is going to get. There was a study called the Predict study that looked at genetically identical twins, looking at their metabolic responses to various inputs. And believe it or not, genetically identical twins don't have the same metabolic response to things. The paper
Wow.
concluded that it's really only 20% genetics and 80% environment. And what environment means in this case is the way you're living your life. So that's good news, right? Because that means that we all have the opportunity to have an impact. If we do the right things, if we assume the right practices, we can live longer, have a longer,
Mhm.
happier life. And but the piece of data that we bring to it is that we can tell you whether you are, we can help you sift through the myriad of choices that you have and see which ones you are indeed most responsive to, and therefore which things you should keep doing the rest of your life.
Interesting. So give me some specific examples. Can you tell things in my blood chemistry about my diet, my exercise, which is good, which is bad?
Yeah,
What's the
yeah.
specific recommendation that you would give me if you analyze my blood for multiple 21-day cycles?
Yeah, absolutely. So, very specifically, we have one program called the Okinawa plan, and it basically has elements of the lifestyle in Okinawa. In Okinawa, there's a huge abundance
Centenarians.
of centenarians, right? As one of the
Yes.
as it's called, blue zones. And so why is that? So the people of Okinawa are genetically indistinguishable from people in the rest of Japan, and Japan has a lot of longevity too, but Okinawa has a ridiculous amount of longevity. So what is it? It's not genetic. So what is it? It's their lifestyle. So research has identified a whole number of things that people are doing in that community, which can have an impact on blood chemistry. And so we've put together a package of 7 of those things, which are on average high impact. And then we can tell you which of those things you are particularly responsive to. So, you might find that salmon really causes, over 21 days, it causes a huge blood pattern response to, in your blood. And so you might want to keep doing that. And, there's also, uh, there's a type of mushroom, reishi tea, um,
Hmm.
mushroom tea that is also very functional in our research study. But again, you might be at the high end or you might be at the low end of that functionality. So at the end of
Hmm.
21 days, you're basically over the months, you're developing a ranked list of your highest response nutrition and fitness practices. We take
Hmm.
the top 10 of those actually, and we add them up into a score because we think people like the idea of a number. There's a segment of our community that is very highly competitive. So, you can build up your score month to month. You can, and it's scaled somewhat like a FICO score. So,
Hmm.
you can
Hmm.
be at 800 or you can be at 400, right? And which do you want to be? So, month to month, as you do more and more programs, you can build up your core score.
I'm assuming you've used it yourself. Did you learn something about yourself?
I did find that I was very responsive to salmon. I need to eat more salmon in my diet, and I do that now. And also pistachio nuts. I think I mentioned pistachio nuts before, and my team gets pretty bored with me talking about pistachios all the time. But I mean, it lowered my fasting. So at the time we would do blood panels, medical blood panels alongside the doing of the intervention, and it caused huge changes in my blood triglycerides, fasting
Hmm.
triglycerides. And of course, we saw the same sort of pattern changes in the core fingerprint.
Hmm. Interesting. So you're now available. You have launched. How does somebody get it? How much does it cost?
We launched and we have units. They went out of stock for a while, but they're coming back into stock, so the timing is impeccable. We have a limited number of units. We have a blended model where we charge $199 for the initial spectrometer, and that goes into your home and you set it up. You then pay a recurring membership fee to keep doing the programs and getting more cartridges that you need in order to run the experiments. And that's $19.99, $20 basically per month. Multiple people in the same household can use the same console. So you could have your whole family using it, the adults in your family using it, and everybody pays a membership fee, but there's only one console fee.
Hmm. Hmm. I gotta ask, can you hack the spectrometer? Can you use it for other stuff and discover other material compositions?
Funny you should mention that. There is a lot of the literature data in the field of spectroscopy uses the same type of spectrometer in the same wavelength region that we're using for doing quality analysis of food and medicinal products. One of the big hot areas right now is understanding the legitimacy of olive oil. The basically,
Mhm.
is it, you get a bottle of olive oil? Is it really olive oil or is it canola oil?
I've
And
heard. I've heard.
yeah, yeah, yeah. And near infrared spectroscopy is one of the primary means of authenticating olive oil. We don't offer that as a product offering, but I thought I'd make that connection with the technology. Another one is measuring the protein concentration in wheat. So for wheat farmers, it used to be that you would sell your wheat based on weight, just how much does the crop weigh,
Hmm.
and you would get paid based on that. But now you pay based on the protein content, which is a more fair way of compensating farmers for their crops. And that's all because they all have near infrared spectrometers hooked up to to the place where you deliver the grain.
Well, it'd be interesting to see if this is something that, after you fully launch and you're up and running, you find other ways to use the same platform that you've put into houses. Now the houses have a spectrometer. Hey, what else can we do there? That sounds pretty cool. Let's couple things left. I want to talk about what you're seeing in terms of results for people who are using this, but maybe before we get there, you got a round of funding. Talk about that briefly.
Yeah, we've raised a total of $15 million in our history. We've raised $12 million from two top tier VCs in two different rounds. So we raised first from Coastal Ventures, and then a second raise, both Series A raises. We raised the second raise from Founders Fund with Coastal Ventures also participating in that round. And so they're hugely helpful to us, and we really appreciate their support. So that's gotten us where we are, and now we're in a go to market phase. So within the next 6 to 9 months, we'll be raising money again.
Hmm.
But I mean, what else can I tell you? Having two top of the top tier VCs as backers has been game changing for us, and we can't thank them enough.
And you said you're in Menlo Park. I mean, that can't be a bad place to be raising money. I mean, it's kind of the place to go for the VC community.
You know,
Maybe,
yeah.
maybe let's
I,
go ahead. Sorry.
I just was going to say, I mean, I'm a real sort of believer in Silicon Valley. I think it's different now. You can raise money in a lot of different parts of the country, but there probably won't be another Silicon Valley.
Hmm. Hmm. Yeah. So you've had people using this, testing it. You've used it yourself. You've eaten your own dog food. What are the results? Can you quantify that for us in some way, shape, or form?
Yeah, to me, it's really all about empowerment. For somebody to be able to know that they can be in control of these decisions, and it's almost like sometimes when I've come up with technologies, other people look at it and they say, "Well, why didn't anybody think of this before?" Right? I've had this multiple times in my career, but there's a real missing link. I mean, you want to be able to improve your nutrition and fitness, and there are lots of great ways. In fact, there's a recent study out in the literature that says that if you do all the right things from a nutrition and fitness perspective, you can add 15 quality years of life to your life on average across the population. I mean, that's just crazy, right? And
Hmm. Hmm.
so the ability to have a new tool that gives you this deep personalized information to know what things are good for you and what things aren't good for you, that's or are less good for you. That's very validating and very empowering. And to me, this is the future. This is the ability to actually take control, and with an understanding from a piece of data that, I mean, anybody could have built this, but it's
You
uh,
happen to.
we happen to do it. So I think every home is going to have a core spectrometer in it someday, because this is going to be the way people understand their own metabolism and their own response to food and fitness.
That's a really interesting statement, actually, because if you look back, sheesh, I don't know how far you need to look back. Not that far. Decade, 2 decades, maybe three, but probably two. And you said, a significant percentage of the population will wear something on their body that analyzes how they move, what they do, what their heart rate is, a variety of other factors, and will give them some kind of score. Right. I mentioned Aura.
Right.
I have the Aura ring here. I get a score from that. I get a sleep
Yeah.
score. I get a wellness score or a readiness score, a couple other
Right.
things like that, activity score. I have the
Yeah.
Apple Watch, right? And I'm getting data from that. Most people 20 years ago is, are you crazy? Are you nuts? It sounds like science fiction. And when you say right now, most people will have a spectrometer in their house. They'll be able to analyze their blood and see how healthy they are. That also has a tinge of insanity to it, but also has something, that would be just normal. I mean, like, health is going to be delivered like many other things
That's
digitally.
right.
And it's going to be delivered over the cloud. And your doctor is going to be an AI that gets your data from your Apple Watch and from your Aura. And now your blood samples. Imagine that. And now your blood samples, and we'll just see when things are out of whack or whatever, a little interesting, inform an actual physical human doctor occasionally
Yes.
who might give
Yeah.
you a call and give you a stern talking to, or say, attaboy, right? Or whatever the case might be. So that is really an interesting
Yeah.
vision.
Here's to the crazy ones, right? I mean, that's what my ex boss, promoted. This is really in some ways consistent with that vision from Apple. That if you have enough bandwidth on a device in your pocket, like an iPhone, with enough computing power, and you have technologies like the cloud, I mean, what are we going to be able to manage ourselves, right? That were previously the domain of experts that we had to hire to give us the understanding. So yeah, that's very much the path we're on.
It's also interesting because health is very personal, but the way we
Yeah.
pay for it is very social. So
Yes.
I happen to live in Canada, and we have national health care, right? I was delivered provincially, but it's just some sum is taken off of your paycheck, and you go to the hospital, you don't think twice about it. You go to the doctor, you don't think twice about it. Very different in the States, but you may pay for healthcare again via your paycheck, and you get services. Most countries in the world are socialized or general healthcare. Uh, if you're adding 15 healthy years to people's lives, there's an economic and financial benefit to that. Not only from being having more productive years, but also having fewer degenerative diseases that you struggle with for 5 years, for 10 years, for 15 years, and
Yeah.
fewer doctor's visits and fewer hospitalizations and all that stuff. There's a huge benefit here that a country and maybe a healthcare system might want to get this in people's hands.
Yeah. Yeah. It's really hard to compute sometimes. It doesn't connect in the brain exactly right, because in the United States, the healthcare system will pay for an intervention, a medical intervention, or a therapeutic. So either a surgical procedure or a pharmaceutical, if it's cheap enough, so that it can provide one additional quality year of life to one person for less than $150,000. And now you're talking about these things related to nutrition and fitness can provide 15 quality years of life. It doesn't add up, right? It doesn't make sense. It's like two
Mhm.
different worlds. And of course, it's the idea of preventing rather than becoming chronic or critical, right? And
Yep.
it's just so much harder to see at that point. But yeah, I'm a firm believer. It's the future. I think medicine, is. I mean, there's never been a better time to be alive if you have cancer, for example. I mean, the survivability is just phenomenal. And so,
Mhm.
not to take anything away from all those interventions, it's just what gets me up in the morning is thinking about nutrition and fitness, and how do we keep people on a healthier track and keep them away from those other endpoints.
Super interesting. We have to cut this. We have to come to an end. We can't go in on talking forever, but there's so much more to think about here. We hit on AI and healthcare. We know that in the US, healthcare is not delivered equally. In other countries, it's not either. We know that in China, rural China, there's one doctor for thousands and thousands and thousands of residents, and there's no way they can deliver healthcare, which is why in China they already have AI healthcare systems that are managing some of that stuff. And we're going to
Absolutely.
see that globally as well. Being able to
Yep.
get this kind of data in there, absolutely huge. Bob, I want to thank you for your time. It's been super interesting. Thank
Thank
you.
you. It's been great. Appreciate your time.